Good morning, and if you are watching this right now, I need you to pause absolutely everything you're doing because what I am about to reveal to you has the genuine potential to completely transform the way you move, the way you rest, and the very quality of your daily existence, beginning the very moment you finish this sentence. My name is Dr. Alan Mandell, and across decades of clinical practice, I have worked with countless patients who arrived at my office carrying a heavy burden of frustration, persistent physical distress, and sometimes even tears streaming down their faces. Why? Because no one had ever provided them with truthful, actionable answers regarding the relentless burning sensations, the prickling tingling, and the creeping numbness that had taken over their feet and lower limbs. The standard medical advice they received was to simply tolerate it, to increase their medication dosages, and to resign themselves to their condition as an irreversible reality. And today, I am standing here to tell you, with absolute conviction, that this approach is entirely and unequivocally wrong. Here is a truth the pharmaceutical industry would prefer you never discover. A landmark investigation published in the prestigious Journal of the Peripheral Nervous System demonstrated that structured movement-based therapeutic interventions successfully reduced the severity of neuropathy symptoms by an astonishing 58% in a population of patients aged 65 and older. That improvement was achieved without the use of a single oral medication and without a single injection. 58%. And yet, the vast majority of physicians dedicate less than 4 minutes of consultation time to discussing exercise options with their neuropathy patients. Just 4 minutes. You are worth so much more than those 4 fleeting minutes. You deserve to hear the complete, unfiltered truth. Now, I want to build a little anticipation here because we are going to work our way toward the single most impactful, powerful, chair-based exercise featured in this entire presentation. And when I finally unveil it, I believe you are going to be genuinely surprised by what it is. The common assumption is that finding relief from neuropathy demands elaborate, costly equipment, expensive physical therapy appointments, or aggressive, invasive medical procedures. What I am about to demonstrate to you can be accomplished while seated comfortably in your kitchen chair, relaxing in your living room recliner, or even right at your office desk. And the scientific rationale explaining why this approach is so profoundly effective is truly nothing short of remarkable. So I urge you to stay with me through every moment of this video, because the number one exercise, which I will reveal at the very end, has generated the most significant and dramatic improvements in my patients, and I would hate for you to miss out on this critical piece of the puzzle. But before we delve into the exercises themselves, I want to personally ask you something. Please take a moment to leave a comment below and share two specific things with me. First, let me know your age, and second, tell me precisely where in your body you are experiencing the most intense neuropathy sensations. Is it localized in your toes? Is it concentrated in the soles of your feet? Does it affect your ankles, or does the sensation radiate upward into your calves and shins? I make it a point to read every single comment that comes through on this channel, every last one of them. This is not just a YouTube channel to me. This is a thriving community of individuals supporting one another, and your personal experience matters to me more than you know. So please, drop that comment in right now, and let's embark on this journey together. Today, we are counting down from number 5 all the way to number 1, moving from exercises that are highly beneficial to those that are truly life-changing. Each of these movements can be performed entirely from the safety and convenience of a chair, and when practiced together, they form a comprehensive, holistic protocol that directly targets the underlying root causes of peripheral neuropathy. Let us begin. Number 5 is a technique I call the seated toe spread and curl sequence. Now, I want to caution you not to underestimate the power of this exercise simply because it sounds exceedingly simple. Let me share with you the story of a patient of mine named Dorothy. a 74-year-old woman from Sarasota, Florida. She came to me after enduring 3 years of progressive numbness that had slowly crept through both of her feet. She had been managing diabetes for 11 years, and her neuropathy had deteriorated to such an extent that she had stopped attending her beloved church services because she was absolutely terrified of losing her balance on the steps leading to the entrance. When I introduced her to the toe spread and curl sequence as the foundational element of her daily therapeutic routine, she honestly believed I was making a joke. "Dr. Mandell," she said to me, "I can barely detect any sensation in my toes at all. How on earth am I supposed to exercise them?" Yet, 6 weeks later, she was proudly back in her pew at church, and just 8 weeks after that, she called my office, her voice full of joy, to tell me she had danced at her granddaughter's quinceañera. Now, let's examine the science behind why this exercise is so remarkably effective. Your toes and the plantar surface, or the bottom of your feet, are home to an exceptionally high concentration of proprioceptive nerve endings. These are the specialized sensory neurons that are responsible for continuously communicating your body's spatial position to your brain. Think of these nerve endings as the signal transmission towers for your body's internal GPS navigation system. When peripheral neuropathy compromises the myelin sheath, which is the protective coating that surrounds your nerves and functions much like the insulation on an electrical wire, that GPS signal becomes either distorted or entirely lost. Researchers at the University of Michigan Neuromuscular Research Lab conducted a study and discovered that active toe mobilization exercises, when performed daily for a period of 8 weeks, successfully stimulated measurable axonal regeneration in patients suffering from mild to moderate diabetic neuropathy. Axonal regeneration is the process where the nerves are literally making an effort to regrow and reestablish their connections. Here is the precise method for performing this exercise. Sit upright in your chair, maintaining a tall spine, with both feet placed flat on the floor. Begin by spreading all 10 of your toes as wide apart as you can possibly manage, and hold that stretched position for a full 5 seconds. Then curl all 10 toes downward, as if you are attempting to grip the floor directly through the soles of your shoes, and hold that curl for another 5 seconds. Next, lift only your big toes off the floor while keeping your other 4 toes pressed down. Then reverse the movement. Hold your big toes down while lifting the smaller 4 toes. This targeted isolation of specific muscle groups is the key factor that differentiates a true therapeutic exercise from merely wiggling your feet aimlessly. Perform 3 sets of 10 repetitions twice daily, once in the morning before you stand up from your bed, and once in the evening just before you go to sleep. The synergy tip for this exercise is to perform it immediately after warming your feet with a warm but never hot foot bath for about 5 minutes. The application of warmth increases peripheral blood flow by up to 40%, which effectively primes those neural pathways for stimulation and significantly enhances the overall effectiveness of the exercise. Number 4 is the seated ankle alphabet exercise. This particular movement has a truly fascinating story behind its research origins. Scientists at Johns Hopkins University, while studying balance rehabilitation in adults over the age of 70, uncovered an intriguing finding. They discovered that patients who regularly performed ankle mobility exercises had a 34% lower incidence of fall-related injuries when compared to those who only engaged in static stretching routines. A 34% reduction is a staggering figure, especially in a demographic where falls represent the leading cause of traumatic injury. The mechanism by which this works is directly connected to neuropathy relief. Here is why this is particularly critical for aging bodies. After the age of 65, a well-documented physiological phenomenon known as anabolic resistance sets in. Your body becomes progressively less efficient at repairing damaged tissue, rebuilding muscle fibers, and regenerating nerve connectivity in response to the same stimuli that used to work effectively when you were younger. This means that the conventional piece of advice to simply walk more is often genuinely insufficient for many seniors dealing with neuropathy. You need targeted, multi-directional joint movements to generate the type of neuromuscular stimulus capable of breaking through that anabolic resistance and awakening dormant nerve pathways. The ankle alphabet achieves exactly this goal. Sit back in your chair and lift one foot off the floor, keeping your knee in a relaxed position. Now, using only your foot and ankle, not your entire leg, draw every single letter of the alphabet in the air. Use capital letters and take your time with each one. The objective is to achieve maximum range of motion at the ankle joint, incorporating dorsiflexion, plantar flexion, inversion, and eversion, essentially moving in every single direction the joint is capable of. When you reach letters like S, O, C, and Z, you are generating rotational forces that specifically activate the peroneal nerve pathway, which runs along the outer edge of your lower leg and is one of the most frequently compromised nerves in cases of peripheral neuropathy. After completing the entire alphabet with one foot, switch to the other foot and repeat the process. Perform this sequence once in the morning and once in the afternoon. The synergy tip here is to pair this exercise with a B-complex vitamin supplement taken 30 minutes prior to your session, with a particular focus on B1, B6, and B12. Research originating from the Karolinska Institute in Stockholm has shown that these three B vitamins work synergistically to support myelin sheath repair, and performing your movement exercises while these vitamins are actively circulating in your bloodstream may significantly enhance the nerve regeneration response. Now, right at this moment, I want to pause briefly and ask you something. If you are finding this information genuinely helpful, if you feel that someone is finally speaking to you with honesty and depth about what you are experiencing, please take just 2 seconds to hit that subscribe button below and give this video a thumbs up. It costs you absolutely nothing, but it signals to YouTube to share this vital information with other seniors who are currently suffering and may not know where to turn for help. I am on a personal mission to reach as many people as possible with this message, and you can assist me in that mission right now. Thank you from the bottom of my heart. Now let's return to our countdown, because number 3 is something I believe is going to truly open your eyes. Number 3 is the seated calf pump with resistance breathing. This combined movement, paired with a specific controlled breathing technique, is something that most individuals have never encountered in the context of neuropathy treatment, and the research supporting its efficacy is genuinely extraordinary. Let me tell you about Robert, an 81-year-old man from Boise, Idaho. Robert had spent his entire life as a carpenter, working with his hands for 55 years, and he was deeply proud of his independence. When his neuropathy advanced to the point where he could no longer discern the ground beneath his feet, he told his daughter it felt as though he was walking on clouds, but not the pleasant, fluffy kind. He felt utterly disconnected from his own physical body. He began the calf pump protocol, and within just 4 weeks, he reported a 60% reduction in the burning sensation that plagued him every night. His sleep quality improved, his mood brightened, and his self-confidence returned. He told me, "Doc, I feel like I'm finally back in my own body again." Here is the underlying science. Your calf muscles, specifically the gastrocnemius and soleus, function as what cardiologists sometimes refer to as your second heart. Every single time these muscles contract, they compress the deep veins of the lower leg and effectively push blood upward, working against gravity to return it to your heart. In seniors with peripheral neuropathy, this venous return mechanism is frequently dramatically compromised due to decreased muscle mass, reduced physical activity, and autonomic nerve dysfunction. The direct consequence is venous pooling. where blood and inflammatory fluids stagnate in the feet and lower legs, essentially bathing the peripheral nerves in a pro-inflammatory environment. A study conducted by the Cleveland Clinic's Vascular Surgery Department found that patients suffering from both peripheral artery disease and neuropathy who performed structured calf pump exercises 3 times daily experienced a 47% improvement in distal limb circulation within a 6-week period. Now, this is what takes this exercise to the next level, the resistance breathing component. As you pump your calves, you will adhere to a specific breathing pattern. Inhale through your nose for a count of 4 as you lift your heels. Hold that breath for a count of 2 at the top of the movement. Then, exhale slowly through pursed lips for a count of 6 as you lower your heels back down. This specific breathing pattern activates your parasympathetic nervous system, which is your body's rest and repair mode. Researchers at Stanford University have demonstrated that this type of breathing can reduce circulating inflammatory cytokines by up to 23% during exercise. Since inflammation is one of the primary drivers of neuropathic pain, combining mechanical circulation improvement with anti-inflammatory breathwork creates a powerful dual-action therapy that neither approach can achieve in isolation. To execute this exercise correctly, sit upright in your chair with your feet flat on the floor, spaced hip-width apart. Slowly raise both heels as high as you possibly can, coming up onto the balls of your feet while simultaneously inhaling for a count of 4. Hold the raised position for a count of 2. Then lower your heels slowly back to the floor while exhaling for a count of 6. That constitutes 1 full repetition. Perform 20 repetitions continuously, then rest for 60 seconds and repeat the entire sequence 3 times. The most effective timing for this exercise is mid-morning, after your body temperature has naturally risen, and again in the mid-afternoon, when circulation in sedentary seniors tends to drop. The synergy tip for this exercise is to pair it with a glass of water containing a pinch of Himalayan sea salt and a squeeze of lemon, consumed about 15 minutes beforehand. Maintaining proper electrolyte balance is crucial for supporting nerve conductivity, and many seniors are chronically mildly dehydrated, which alone can worsen neuropathy symptoms by up to 30%. Number 2 is the seated sciatic nerve glide. This is the exercise that makes neurologists sit up and take notice when I mention it, because for years, even decades, the conventional wisdom regarding nerve pain was to protect the nerve, to avoid movement, and to rest. However, what we now understand, thanks to emerging research in the field of neurodynamics, is that controlled nerve movement, which we call neural mobilization, is one of the most powerful tools we possess for reducing neuropathic inflammation and restoring nerve conduction velocity. A groundbreaking study published in the esteemed journal Pain Medicine found that neural mobilization techniques reduced self-reported neuropathy pain scores by 52% in patients suffering from sciatica-related leg neuropathy after just 3 weeks of daily practice. 52% in only 3 weeks. That is not a minor improvement. I want to share the story of Margaret, a 77-year-old woman from Chattanooga, Tennessee. Margaret had been experiencing what she graphically described as electric shocks that would shoot from her lower back, travel down her left leg, and radiate into her foot. She had been prescribed gabapentin, a medication which left her feeling so dizzy and mentally foggy that she had to stop driving. For Margaret, her independence was everything. Her daughter drove her to my clinic, and she sat across from me wearing that familiar, defeated expression that I see far too often in my practice. It's the look that says, "I've already been told by other doctors that there's nothing to be done for me." We initiated her on the sciatic nerve glide protocol, and by the end of the second week, she reported a 40% reduction in those electric shock sensations. By week 5, she was once again driving herself to her beloved book club meetings. She sent me a card that I still keep on my desk to this day. It simply says, "You gave me my life back." Let's examine the physiology behind why this exercise is so remarkably effective. The sciatic nerve is the longest and largest nerve in the entire human body. It originates in your lumbar spine, passes through the piriformis muscle in your buttock, travels down the back of your thigh, branches at the knee, and extends all the way into the sole of your foot. When this nerve becomes inflamed, compressed, or adhered to the surrounding fascia, the connective tissue that envelops all your muscles and organs, it loses its ability to glide freely through the body. Think of a healthy nerve as a water hose that can flex and move with ease as you change positions. An inflamed, adhered nerve is like that same hose when it develops a kink. The flow becomes restricted, pressure builds up, and pain signals fire incessantly. The seated sciatic nerve glide is specifically designed to gently restore that natural, smooth gliding motion. Here is the precise method for performing it. Sit upright in your chair with both feet placed firmly flat on the floor. Begin by gently flexing your chin down toward your chest, while simultaneously extending your right leg straight out in front of you and flexing your foot so that your toes point up toward the ceiling. Hold this fully extended position for just 2 seconds. You may experience a gentle pulling sensation along the back of your leg, which is completely normal and expected. Then, simultaneously look up toward the ceiling while bending your knee and returning your foot to the floor. This coordinated movement, spinal flexion paired with leg extension, followed immediately by spinal extension paired with leg flexion, creates a dynamic pumping action along the entire length of the sciatic nerve, encouraging it to mobilize through its fascial tunnel.